Hi everyone, I hope this is working. It's my first Instagram live, so bear with me and I hope that I am getting live here. Fantastic, I think we're live. It's Dr. Hirmand speaking to you from New York City. As most of you know or may know, I'm a plastic surgeon in practice here. And I've been getting a lot of questions from our patients and also from our followers on Instagram and friends and family over the past few weeks as we've been calling to reschedule appointments, procedures, and surgeries. And in speaking to my colleagues around the country, as well as my international colleagues, it seems like these questions are very much the same questions that recur. So I thought it may be time to just try to answer some of these questions for everyone. And I hope that everyone just takes at least one or two pieces of information to clarify the situation, which is very unclear and uncertain. So first of all, I hope you and your loved ones are safe and healthy. Thanks for joining me. Happy Easter coming up. Happy Good Friday. Happy Passover to everyone. So I have some questions that were submitted via comments, messages, and emails. And again, this is my first Instagram live, so I'm open to suggestions. Please send me questions, give me suggestions. Hopefully I won't mess this up. So learning as I'm going. So the first question is, when will your office, and I presume offices like ours, are opening or reopening, and will you reopen as soon as the city reopens? So we got this question a lot. So I will say that optimistically, sometime in May, I'm confident, and realistically, in June, it looks like we will be on our way to resume function. I listened to Governor Cuomo again today. We have here flattened the curve to some extent, and even though the number of patients that are being lost here are going up still as expected. The hospitalization numbers are down. Many, like now it's going to be 3 to 4 days in a row, so this is an excellent sign. I would say as soon as the city and the state reopens, we're in a position to reopen, but at the end, it's when it's safe for our patients, for all of you, wherever you are, and also for our staff. So I am planning to follow the data very closely as I have been and make determinations in real time, day by day, week by week. So I plan to keep all of our patients informed along the way, and I hope that everyone in my position is doing the same. If you are in parts of the country that are lagging or are having different patterns, I suggest you keep in touch with your providers, your medical providers, and if they're not keeping in touch with you, to ask them to give you updates. Okay, so the other question, or the second question, is when can I do my procedures again? My answer to that is this depends on when it's safe to return to work, and it's safe for all of us to be performing and for you to be receiving them. So I suspect, again, here in New York, it's in the next 4 to 6 weeks. We will be in that position. We'll be sufficiently on the downslope of the curve. I think, and I'm pretty sure at that point, we will be contemplating testing protocols, screening protocols. As many of you know, we did start having screening and elevated protocols in February already, way before the shutdown, as the wave was coming. I'm assuming, and I know that we are going to tweak those, and with diagnostic and antibody testing, be able to implement new protocols where we can keep everybody safe. I also fully expect that we will be using masks, protective gear, and take extra precautions for the coming months and probably for the next 12 months to make sure that everybody is safe until there's a vaccine and until there are treatment protocols that, number one, work and preferably are preventative. So we're going to keep a very close eye on that. Next question. When can we do our planned surgeries? Well, I'm really heartened that everybody is interested in proceeding. This has been our experience. So my answer to that is, again, when it's completely safe for everyone to do surgery. So I will say that probably we are going to be needing some rapid testing, antibody testing. There are two kinds of tests, diagnostic tests that show the RNA of the virus, the genetic material of the virus, and indicate that somebody has been exposed, whether they're symptomatic or not symptomatic, so that we know that. And then there's a different kind of test, as you know, or you may know, which is an antibody test. And that can show acute and potentially protective antibodies. The acute antibodies, the IgM kind, and that will show acute infection, and the IgG kind is the more protective antibody that shows that someone either has been exposed and is protected or has had the disease. And that usually starts about 4 to 6 weeks after the infection. And if we can detect these and identify who is protected, then we can start having protocols to do surgeries safely on everyone. So we're working on those protocols as the science and the data is coming out. So stay tuned. Next question. Is it safe to do treatments like filler and Botox after this COVID crisis? Do elective medical procedures increase the risk of catching COVID-19? Okay, so that's a good question. Elective medical procedures do not increase the risk of catching COVID-19, the non-surgical procedures, as far as we know, in and of themselves. The issue in doing them is being able to do them so that everybody is safe whilst receiving them, and everybody who's doing them is safe. And we're working on ways to assure this. Now, for surgery and recovery, there may be different norms that we're going to apply. Surgery and recovery is a stress to the system. There is an argument to be made that it could lessen your body's ability to fight infection. And perhaps that if someone was asymptomatic, that they would become symptomatic. And also, again, we need to know who these asymptomatic carriers are so that we don't expose them to surgery. And also, risk contaminating people who are not immune to the condition. So for surgery, I think we're going to think a bit more about the protocols and be able to come up with safe ways to proceed. Again, based on what testing is available and what science is out there. And I'm doing my damnedest best to keep up with every scientific article that comes out in the world. So a lot of reading. The next question has two parts. Part number one, when is it really safe to be close to people again in general? This is not to do with doing procedures, but when do I think it's safe to be close to people? Well, so I think it's hard to know exactly when to stop social distancing. Cities, states, countries are going to be at different paces when it comes to this situation. So I think everybody, of course, has to watch their own situation. But I'm convinced that as long as we don't have an effective vaccine, or it's only when we do have an effective vaccine and we do have some treatment protocols that are preventative and also therapeutic that are proven, until that time, we probably are looking at some level of precaution, social distancing, and that looks to be about 12 to 18 months. So we are looking at some level of precautions in our social life and certainly in our professional lives. I think virtual communication is here to stay. Probably it's not going to just disappear, and that's probably a good thing, whether it's for work or for personal reasons. So we're actually better connected, and we're using our technology to be better connected. I also, as I mentioned, the rapid testing for diagnosis and antibody testing to really identify who's protected, who's been exposed, who is vulnerable is going to really make a huge difference as to who can go back to the workforce, how we conduct ourselves socially. So I'm really hoping that this gets facilitated, accelerated, and we have some guidelines. So for the second part, are medical procedures any different than any other close contact situation? Yes, medical procedures are definitely different than just going to a restaurant or going to the grocery store. So, again, for the non surgical kind of procedures that you would be doing and we would be performing, realize that we come very close to the face, to the mouth, to the nose, the virus. Being a respiratory virus, there's a high risk of transmitting it, and there's a higher risk of contracting it unless there are precautions taken. What we do know is that with proper precautions, and as we know more about the transmission and the virus size and the particle size and droplet versus airborne, all this stuff, we do have protective gear. And these are what everybody knows now are called PPEs that are used in the ICUs and the ER. And I'm hoping more prevalently, as you know, the mayor of Los Angeles also just suggested or didn't suggest, mandated that everyone going to any essential business should wear at least a regular mask. So I do believe that we are able to keep people safe. I will tell you that in our practice for years, if anybody has even a suggestion of a cold, if I have a little cold but I'm still able to work, I have been wearing small particle masks. We've never made anyone sick. So I know we can keep people safe. It's just being intelligent, thinking, using the tools, and looking at the data and understanding the science. Now, for surgical procedures, there is a variable, and that's anesthesia. Again, we have to be careful. For different kinds of procedures, we use different kinds of anesthesia, and you may want to be more tuned in with your provider as far as what kind of anesthesia is being used. And of course, intubations, these are higher risk procedures for the anesthesiologist. And also, we always are concerned that we do not create a situation where somebody who's asymptomatic or was not going to get very sick because of anesthesia for an elective procedure is now going to be exposed to risk of getting very sick if they contract this. So again, safety above all. Okay, I think I have one more question, and that's my favorite question. Should I feel guilty about worrying about my appearance during this crisis? Okay, my answer to that is a definitive no. You should not feel guilty. I think some level of normalcy is really therapeutic and it's really good for our sanity, number one. The only time you should be guilty is if your actions in achieving something about your appearance is either endangering your health or endangering the health of people near you or endangering the health of people in the community. So I think if we all are responsible, it's actually probably not a bad thing. It's probably a good thing as long as it is in context ethically with what's going on around us. So I will tell you, I will share a couple of personal things with you. I was delighted to be able to blow out my hair because I knew I was going to be on Instagram Live and perhaps a few people were going to join in. And it was actually very liberating. I don't think I had really done up my hair in weeks. I put some makeup on, I threw on a lipstick, I kind of wore some jewelry, and even when I did Zoom with my girlfriends, I hadn't really done those things. So it actually feels great. So thank you for that. Thank you for giving me the opportunity in some way to do that. So I do recommend that. I think if we can take care of ourselves safely at home and eventually safely outside, there's really no more guilt than a normal time. What is true again is that I think it's important to pay attention to our community and to keep the concerns and the predicaments and the challenges and serious challenges that our neighbors and our friends and our patients and our colleagues are faced with. So that's really my answer to that. As long as it's not out of line with the reality of everyone's life, I think it's okay. So with that, I will say that being on virtual platforms like Zoom and FaceTime has been very humbling for me personally. Every time I look at myself, I'm like, oh my God, I really don't look great. I need to do something to my hair. I was able to go and, I will admit, run and get a haircut just before everything shut down with a mask. So I'm very, very grateful for that. So that's sort of my long answer to that short question. I hope that's helpful. Most important is to stay safe, to keep everyone around us safe, and to help out our doctors, our frontline workers, the best way we can. For most of you, for most of us, it's just to stay home and be responsible. For some of us who are in the medical profession, is to volunteer and do other things to help our ER docs and our ICU docs and nurses and respiratory therapists and all of the community in the medical community. I mean, who are really putting their health on the line, and their families, and they're separated from their families. So again, this is also my opportunity to thank them. If you are a nurse, if you are doing that, I really thank you from the bottom of my heart, and I think we all owe those individuals. So with that being said, I want to finish on a positive note and say that everybody stay positive, stay strong. You know, we have a campaign here in New York tough. So be tough, but at the same time, be empathetic and vulnerable. I don't know for you guys, but we all have cried during this time. We've all been anxious. We've all been stressed. I personally am guilty of all of those things. I think we just have to be kind to ourselves and to everyone and realize that this is a really, really difficult, challenging time. What is important is health, is our loved ones, again, is our globe, especially people around the globe that they may not have the same infrastructure as we do. The silver lining is that we have realized that we're all connected. And this was my way to try to stay connected as well with you. So I want to wish everyone a happy Easter, a peaceful Passover. Thanks for joining me. Stay in touch. We may do this more and answer other questions, talk about related topics, beauty topics, other topics, scientific stuff about COVID. I am doing COVID evaluations as some of you may know, for our patients and their families and friends, and some extended circles in our buildings here where I live. So I am up to date on the science and some of the stuff that's going on. If you want to hear about that, please send me your questions. You can send it through Instagram, either comments or direct message. Okay, so have a great Good Friday, Passover, and stay in touch, stay safe, stay home for someone you love. Thank you.